All right. Hi, everyone. This is Dr. Sasha No here with you today, popping on in between patients. I'm here with Dr. Chad Savage. We're going to talk about direct care. For those of you who don't know me, my name is Dr. Sasha No, and I'm your dual doctorate, board certified, award winning physician and researcher, international speaker, best-selling author, and expert in chronic disease management, preventive health, and medical cannabis. And I help patients who are really frustrated with their current healthcare, who are sick and tired of the high cost of healthcare, who are sick and tired of waiting to get in to see their docs so they can get care, and really help them through direct family care, a direct family care plan in my office. And this is a direct care option for patients. And many patients don't realize that they have this option. And so we're here to talk to you about it today. I've spoken with other doctors, and we'll be posting those videos here across all social media. But if you want more information, you can always go to my website at directfamilycare.com. That's directfamilycare.com. Okay, so we're going to get started with Dr. Chad Savage. I'm going to let him introduce himself. He's completely awesome. I've heard him speak at so many conferences on direct primary care, and I wanted to bring him on here today so that he could really help you, if you're listening, understand how things like a direct care plan can work with, say, an insurance plan, because obviously we want everyone to have insurance. You're going to have potentially, some people have catastrophic things happen. Maybe you end up in hospitals, maybe it's broken, whatever, you need surgery. We want you to have access to insurance in that level. But most people, like myself, really pay a ton of money for health insurance and have these massive deductibles that really end up costing me way more in healthcare costs than going the direct care route. So Dr. Chad, welcome, welcome, welcome. Thank you for taking time out. I know we're both in between patients here today, but
Yeah,
introduce
thanks for
yourself
having
for
me on.
me, please.
Yeah,
Absolutely.
it's actually funny. I had no idea you were so accomplished, and may I add, she's a really nice person too. So the one thing she left off. Yeah, so I have a direct primary care clinic in Brighton, Michigan. We've had it for a little over 3 years now. I trained at U of M, Case Western Reserve University, and Washington University in St. Louis, and practiced internal medicine. And I knew that when I started actually in private practice in the 2000s, that there was something really broken with the healthcare system. So I started looking into it, and to my surprise, so much of it was, everything that was going wrong seemed to have the common point of how we finance it. So I started looking around for alternative models, and I found out about direct primary care, and I know you heard about that from Dr. Umber. For so many people, the worry was, well, how do we make this affordable to people? You know, the people are paying for us, whether they realize it or not. They pay for us through premiums, through taxes, through deferred wages. And what that means is, a lot of people say, well, my employer pays for my health care. Well, trust me, even though you may have a wonderful employer, they're not doing it out of the goodness of their heart and altruism. They could have given you that money that they spend on your health insurance as wages, and many people would actually prefer that, but instead they give it to you in the form of a healthcare benefit. So the key is how if you're able to design your own coverage options, how do you design that in a way to make it much, much less expensive without compromising the care? That's the key. In fact, maybe even getting better care. And the system is so broken, newsflash there, I'm sure no one realized that. The system is so broken that you actually can make it vastly, vastly better while also saving money. It's actually possible.
Yeah, amazing. And I think for patients in general, they have difficulty just sort of envisioning what that really can look like for them. We're used to being in the traditional sort of, buy insurance and make sure we have, insurance, but then they can't really get care because then their
Mhm.
deductibles are so high. So, one of the things that I've really learned a lot about is how we can pair a direct care plan, like a direct family care option, like you also offer at your practice in Michigan, to patients in combination with other healthcare insurance or plans. So can you talk a little bit about that for patients who might be going, well, it's open enrollment. How do I select a great plan for me that will meet the needs of my family? And how can I really, if I have chronic medical conditions, like, which of course direct care is so great about, that
Yeah,
option is to help
yeah.
patients chronic medical conditions, what are some things that they can consider, and explain how some of these like catastrophic plans might work in combination with a direct care and who that might be appropriate for.
Yeah, it is so interesting because you referenced paying through your insurance company and how in the United States there's this fallacy that insurance equals care. Well, insurance is not. It's just a mechanism of payment, and you can get care. In fact, you can get better care when the insurance is not involved at all. So there's several ways of designing it. So direct primary care, as you probably know from the discussions with Dr. Umber, is usually a membership model. It's usually reasonably very inexpensive, usually much less than a phone bill, usually between anywhere from $40 to $100 a month for unlimited primary care office visits. But then many doctors also, include diagnostic testings that they do in the office, EKG, spirometers. Some do home visits. Many have in-office pharmacies, meds, labs, imaging, all these services that they can get very discounted rates on top of the membership. So the key is if you can get a lot of services for a good price, see your doctor as much as need be, get an MRI for $279, get a chest x-ray for $38, get a 100-day supply of Norvasc for 80 cents. Why did you need insurance to cover an 80-cent prescription? The answer is you didn't. So keep insurance for what insurance is intended to be. In its essence, insurance is a financial tool to prevent catastrophic financial loss. But unfortunately, in the United States, we're using it essentially as prepaid medical care and adding all the middlemen of the insurance onto that. And that does not decrease the cost. It increases the cost. It adds a lot of barriers and obstructions to the free practice of medicine because then for the doctor to get paid, they really have to jump when the insurance company says jump and can't do necessarily everything that they want to do and feel is appropriate for the patient because of the various stipulations that the insurance company places on that payment. Okay, how do you get around that? So if using with direct primary care, it is more cost effective since you're getting so much of your care directly to get a less expensive coverage product. Now, the problem is there aren't a lot of those around right now, at least through the exchanges. So one of the really nice alternatives that a lot of people don't know about is something called health sharing. And there's a lot of different versions. Most of these are what they call Christian health sharing organizations. And some do require active participation in churches and things of that sort, but not all of them. Liberty Health Share, you don't have to be Christian to use, and Sedera and I believe Altrua and some of the other ones out there are starting to function in a more secular basis where you don't have to actively be involved in a church to participate with them. And then there's the old ones, the historic ones, MediShare, Samaritan Health Ministries, CMF Curo, which is their Catholic version, Christian Healthcare Ministries, and of course Liberty, which are usually about a third the cost of traditional insurance, if not less. Now, when you get that inexpensive coverage, that works really good with inexpensive, not cheap, because it's high quality. It's, cheap conveys, poor quality, high quality, but inexpensive medical care. So if you can cut costs on the care and cut costs on the coverage, many people can be thousands of dollars better off every single year. Oh, and if I can say too, there is kind of a recurrence of the historic catastrophic coverage, which are the short-term healthcare policies. These now are allowed to be renewed out to 36 months. And they admittedly don't cover much, but they also don't cost much. So when you combine that with direct primary care, you have coverage for hospitalization and major events, which are rare, thankfully. But the common things you get covered through your direct primary care doctor. So for $100 a month, you can get a short-term policy. And then for $50 a month, see a direct primary care doctor, and you're getting, for $150, your coverage and unlimited doctor's office visits. Compare that to $800 or whatever someone's paying now under the traditional plan. And that's just for having that piece of plastic, the insurance card in your pocket, and they haven't even seen a doctor yet. With that $150 through a catastrophic in combination with direct primary care, you have your insurance and you saw your doctor as much as you wanted.
Right. And, I know that, even personally for me, I have shared before that, for my family in the past, we have spent, anywhere from $1,300 to $1,500 a month for a, health insurance plan that has, a $6,000 deductible per person, $13,000 deductible per family. And, it's like, unless you end up in hospital or something like that, it really, you're paying a lot of money when you can really pair a lower premium deductible, like a health sharing plan, or maybe a lower level coverage or premium plan with a direct primary care plan, and have, essentially, I know in our office we do, what we call essentially unlimited. We have 25 visits a year. I mean, I don't get anybody that gets that close. Plus
Yeah,
we
yeah,
have medicine visits. We have steeply discounted costs for blood work. It's always fun when the patient brings in their bill under their insurance for their blood work, and it was $700 to $1,500, when we can get it done
yeah,
for under $100, most times under $60. And
yeah,
it just blows my mind. And so patients, part of what we're doing here is just really trying to educate patients on their options and what the value of direct care can be for them.
yeah.
So um,
You probably can't see this, but these are some of the prices that we get for common labs.
right,
And
less than
just
$4 for a CBC, I mean, or whatever that was.
yeah,
It's unbelievable when you start adding those up. $60 maybe for a full fasting.
yeah. I mean, a cholesterol panel, a CMP, and a hemoglobin A1C, that's a pretty good diabetic test,
Yeah,
is $14.02.
right,
14. I mean, it's just crazy. And people pay hundreds and hundreds of dollars for this stuff. Um, so it's an amazing potential for cost savings by just getting good prices. The prices are all screwed up. They're all fictitious. I mean, who knows where these numbers even come from? Our local university hospital charges $4,200 for an MRI that we can get on the cash market for $279. I mean, it's
right.
medications. I didn't even know until we started doing this just how marked up things were. I mean, they're not 10 or 100% marked up. They're thousands of percent marked up in some situations. It was funny, you were talking about the coverage. Just today, I saw a new patient who was converting. He had a $1,300 a month premium for his family with a $15,000 deductible. That means if in a given year, before anything is covered, he would have spent $30,000. Just as an example, if he did a health sharing organization for his family, he could get the coverage, and it's not an insurance contract, but it is a form of coverage and actually recognized by the government as a form of coverage, because you don't get the ACA or Obamacare penalty if you have one of them. But it's right around $5,000 for a year for a health sharing organization. And then, if you add on a couple $1,000s for a full family over a full year, or, for direct primary care, you're talking maybe $7,000 a year for all the doctoring you need. Whereas that one, you got to spend $30,000 before you even walked into the doctor's office, to have them cover anything. It's insanity.
Yeah, when you look at the annual cost like that, it really makes a huge difference. And that's really one of the things, those that are shelling out the money to pay for these high premium plans, are really struggling with. I mean, having been in practice for the last, 6 to 7 years here, where I, seen patients, over the years, yes, they've had insurance, but they're certainly not coming in for care until it's too late, because it's costing them too much money. Whereas with a direct care plan, they have access to their primary care doc. And, we take care of so much and can take care of so much for the patient that can save them so much money. So, as much as we want to, help our patients, people like you who can help explain this to someone, really makes a huge difference, and really gives them ideas of ways that they can think out of the box. And that's really kind of what we do as direct primary care docs that are helping patients sort of think out of the box, because we've, started to think out of the box. You've been doing it for a lot longer than I have. But certainly, I
And
think.
it's so important. I don't mean to interrupt, but it's so important to have a doctor that understands that and how to access those resources locally. Before I converted, again, we thought in the insurance terms, which are, well, just use your insurance. Just use your insurance. Well, why do you care what it costs? Just use your insurance. In fact, the people do care what it costs, mainly with the deductible skyrocketing for people. And I remember a specific patient where she and I sat down and we were figuring out an issue for her, and we talked for a good half an hour, and we were figuring out a plan for her and what to do. And finally, we agreed. He said, does this sound like a good plan to you? Yeah, sounds like a good plan. How about you? Yeah, okay, good. So I start walking out the door. She goes, oh, hey, doc. Yeah. She goes, well, how do I afford that? I stopped and thought, well, I don't know. Well, good luck with that. And I went out the door, and I thought, this is terrible. This is terrible. The chance that this lady is going to ever do what we discussed is almost zero. Because and prior to that, I really hadn't thought about it. What's nice about direct primary care is you have a doctor that is thinking about that. You know, it seems for doctors to talk about money almost seems kind of unseemly. And so a lot of doctors worry about doing something like direct primary care because it's so unseemly or being paid directly by the patient. The funny thing is, if you ever don't want to talk about money, direct primary care is great, at least for our payment, because you say, hey, $50 a month, does that sound reasonable? You can see us as much as you need. Yeah, it sounds reasonable. Okay, good. We're done talking about money. That's it. You know, now the only time we talk about money is when we're talking about ways to save them money. And it's so fun as a doctor too, because before we had somebody yelling in our office every day about their deductible or some charge that they didn't understand, and who can blame them? It's this ridiculously complex morass. And now we have people, you know, I mean, I'm not going to say truly yelling, but like yelling with excitement and glee over what they're saving. I mean, like, oh my gosh, I can't believe I could do this. And when I had a patient once picking on me because I realized how frugal I've become. I had a CBC, and the difference between a CBC and the CBC with a differential, which is just a slight difference in that test, was 5 cents. And I was sitting there looking at this, and I was perseverating. Well, do I order it with the diff or don't I? Do I order it with the? And the patient just looks over and goes, "Doc, Lurge, get the differential. I'll pay the nickel." And I'm like, "Oh yeah, this is just a nickel." You know? So, but it's when you get these savings, and we were joking at this conference we were at just recently, that we were all excited. We were all sitting up late at night talking about how to save $2 off of CBC. And you know, this is something that charges like $100 through in hospitals and insurance practices. And we're thrilled because we're going from $4 to $2. Right. Now, you know, percentage wise, it's a big decrease, but real dollars, it's pretty trivial, because we've already reduced the price so much.
Yeah. I mean, and the fact that we can continue to find these creative ways to save patients money, knowing that, you know, I mean, for the cost of what an average patient in my practice, for example, pays $67 a month, right? And so for just $804 for the year, they have all of their primary care needs met, including blood work and in-house procedures, whatever. And you start going, okay, what are some other ways that we can save you money if you come in with something else? You know, even our specialists, you know, will work with our patients as well. And you know, and people think, well, what am I going to do? And, you know, at this meeting that we were recently at, you know, there are so many ways for everyone to think out of the box. I mean, there are surgery centers providing surgeries at a fraction of the cost of what it would cost you to build a hospital. I love how so many of these options are becoming available to the patients. And so as long as we can continue to educate them.
Yeah. I mean, we do diabetic test supplies, and we get the monitors for like $4. We get 50 test strips for $7. My wife, who's a pediatrician, had called me once. The reason I started doing those is because she had said, my staff just spent 3 hours trying to get diabetic testing supplies authorized. What does this really cost? Now, understand, she's paying her staff about $20 an hour with benefits. That's $60 in staff time. So I looked into it, and when I realized I could, at the time, I could get the monitors for $1. I could get the monitor for $1 and then get the strips, you know, 50 for about $7. I thought, oh my gosh, how much could we have purchased for the person with the wasted staff time on the authorization to cover something that never should be covered because it's so cheap. Right. And you just see those perverse numbers all throughout the system. And the real innovation in costs and savings is really occurring in this model, because doctors are being freed to work with their patients to try to find answers. We're not pigeonholed into this is the only way you can do things, which the current insurance model is.
Right. Well, listen, Dr. Chad, thank you so much for doing such a phenomenal job, like explaining to those who are going to be listening to this ways that they can really be thinking about their healthcare as well as their healthcare costs. Okay.
Yeah. If I can summarize just for one split second.
Please, go
so
ahead.
Think about direct primary care. Think about merging it with a health sharing organization, short-term insurance, or if you're an employer, you can design self-insurance plans called ERISA-based plans that wrap around direct primary care. And by getting those good prices and merging it with less expensive coverage option, it's hard to go wrong.
Yeah. And so patients might want to know too, if I have questions about where I can find these plans, how would you recommend them go about like talking to their health insurance broker or?
Probably not. So unfortunately they're not incentivized to discuss these kind of options, and I've had some who've become quite belligerent about it. Now understand everything that I'm saying. I'm not an insurance agent. I'm not a financial planner. So these are ideas for people to pursue. These are not specific financial advice. But you can go to the websites for the various organizations: Liberty Health Share, MediShare, Christian Healthcare Ministries, Samaritan, CMF Curo, or the others, and see, is this something that appeals to me? Is this something that meets my needs? There are some limitations. They for example can exclude pre-existing conditions. So if you were just diagnosed with cancer, it may not be the time to sign up for one of those. But if you're relatively healthy, this is a very good option for many people. And if you've had a state of disease that's been quiescent for several years, many times that will be omitted from their exclusion criterion. Look at the short-term policies. That you would want to talk to a broker who's familiar with the short-term health policies, or a third-party administrator who's well versed in setting up self-insurance plans, the ERISA-based plans, if you're an employer.
Fantastic. So I would say for those of you who are watching this video, if you have questions, please feel free to contact us. There will be links posted for you. You can go to my website at directfamilycare.com and you can check out all the information on what we offer here. And you can also contact us through that website, or you can call our office at 813-641-0007. And if you post questions, if you want to do that across social media, you can find me across all social media at Dr. Sasha No. That's DrSashanoE, Facebook, Twitter, everything. You can find me there. So post your questions. We'll get you answers if we don't know the answers, and we'll direct you to where you need to go. And if you know someone who can benefit from this information, again, please share this video so that they can listen. And if you have any questions, give us a call. Again, my name is Dr. Sasha No. Thank you for joining us. I'm your dual doctorate, board-certified, award-winning physician and researcher, best-selling author, international speaker, an expert in preventative care, chronic disease management, and medical cannabis. And we would love to be able to help you with your health care and your care in general, help you to find affordable, accessible, high-quality health care through our Direct Family Care plan. Go to directfamilycare.com. Feel free to ask us any questions. Again, Dr. Savage, I mean, that's a great last name, I gotta say.
Yeah,
okay.
Yeah. I get the superhero references. I don't look like a superhero at all, though. So people are usually disappointed.
And mine, though.
Yes. Superhero got really old and bald.
Thank you so much for joining us and
Thanks,
sharing
Sasha.
your knowledge with everyone listening. Okay. Have a great day, everyone. Bye-bye.